Good evening, everybody. How are you doing? I hope all is well. You see, we are live tonight. We're going to get into this conversation about the big, beautiful bill. We're trying to figure out another name for it, but that's besides the point right now. First, let me do some housekeeping before I introduce my guest. So, if you want to join the chamber, of course, go to www.mygabc.org. You see that scrolling right here on our live this evening. But we do have our next big event, which is everybody's asking us, is the fifth annual Black Business Summit. I'm gonna give y'all some highlights. Jared, our DA, will be featured. We also have Sean Edwards from the Land Bank Authority coming in as well. We also have Maria and Reggie from Senator Warnock and Senator Ossoff's office. So that's just a little bit I'm gonna tell you. I ain't gonna give you too much, but we're gonna have a serious conversation that evening and one tonight. So this is just a pre-up to what you're gonna hear about at the summit. So Bridget, if you can go ahead and tell the folks all about who you are, what you do, and just a little bit about your agency. Don't tell them too much because we're gonna have a fruitful conversation tonight while I do some things in the background.
Okay. Well, thank you so much, President Ronique West, for giving me this opportunity to be able to share some information about the One Big Beautiful Bill and what I do for a living. I am an insurance broker in partnership with my life partner, my husband, William Scott. We are owners of Scott Insurance Agency. Together, Bill and I have more than 2 decades of experience in the insurance industry. We primarily focus on Medicare and the individual marketplace, the under 65. So that's just a snippet. We'll kind of define ourselves a little bit more as we get into this.
You said, how long have you been in insurance?
2 decades, over 20 years.
Over 20 years. Okay, so what made you, let's start at the beginning. What made you get into the insurance agency and why so long?
That's a good question. I kind of ran from it for a very long time. And then my mother-in-law was going to a senior center in Atlanta, Georgia. And I would go in and volunteer every week helping seniors, do their Medicare, apply for extra help with their Medicaid and helping with their taxes and all that stuff. So this lady, she's about 96 years old. She said, Bridget, you need to go ahead and get your license and get paid for this because you won't let us pay you for anything with all of the stuff that you do. She said, so go get your education and go ahead and do this. And so I went home, I talked to my husband and he said, well, why don't you do it? And I have never looked back. I absolutely love what I do. I love helping people. And what better way than making sure we take care and cover the people that we love?
Okay. So throughout the 20-year journey, it's evidently you must love it because you're still in it. It's been 2 decades. Okay. Yes. So some of us are still trying to figure out our lives over the last 2 decades. And here you are in the insurance world for 2 decades. What made you stay so long and what made you fall in love with it and continue? Before we get a little heavy, I just kind of want them to hear about your business first.
Okay. Yeah. Well, we have a combined 2 decades. I started out in 2012. Bill started out thinking 2013. So combined, it's more than 2 decades. It's forever changing, forever evolving. It's a way that we can stay involved and engaged in the community and help people. I've always loved helping people in any way that I can. And so when we see people struggling with understanding what it means to have good insurance, and let me go back. Back in the day, there used to be these policies that I didn't quite understand until I got in the business, where somebody would knock on my grandma's door and she would wipe her hands on her apron and go to the door and say, hey, give me a minute. I'll get my premium, my insurance money for you, and oftentimes it jingled, it didn't fold, right? It was a little bit of money, but they appreciated life insurance and insurance back in the day. fast forward 20 years, 30 years, they weren't worth the money that they paid into it. So I wanted to make a difference and make sure that I could explain it, get into the community, and help people do what they needed to do to secure a legacy.
Okay. So we talked a little bit about your business. I thought that was important. I also wanted everyone to understand your background in your years of just being in the insurance world, because what we have coming upon us is a bill that passed at a federal level. A lot of people are still unaware of it, but this is going to make some major changes in our insurance and in our lives on a personal and business level. So this is what this conversation is going to be about tonight, and beginning to navigate for those changes ahead. So where should we get started at? Because you're the expert. First, can you kind of tell people just a quick, maybe synopsis of what has occurred and why we're having this conversation tonight?
Well, it's called the One Big Beautiful Bill that was passed July 4th, 2025. The implications on the insurance market is huge. A lot of the things are going to either tweak or sunset. A lot of the Affordable Care Act, it's going to change some things. It's going to make some things a little bit different. We know how to navigate turbulent waters, so we're going to be fine. We've gotten through a lot of things, and this too, we'll get through this as well. So with the Big Beautiful Bill, as it relates to the market under 65, and all of those tens of millions of people that signed up for the Affordable Care Act under the Obama administration, there are a lot of things that are going to be different in how we navigate and how we move going forward. The sausage is still being made. We still don't have complete understanding about all the things that are going to change, but I can share with you this evening, Ronique, some of the things that we know are part of what's called the final rule. And the final rule is what CMS and the federal government has said that's going to happen in plan year 2026. As far as enrollment dates, how we enroll, what's left out, what's put in, and those types of things. So if we have an opportunity to have like a series of conversations as this evolves, because it's still evolving. It's still evolving. So we can just jump right into it, or you can let me know how you'd like to go forward. Okay.
Yeah, let's go ahead and jump right into what we know so far. Let's talk about what we know so far.
Okay.
Sure.
Okay.
Let's do that first, because we're gonna break it down.
Okay,
yes, let's start there.
So one of the things that we know is Georgia, the state of Georgia, pulled out of the federal marketplace. There's no more federal marketplace for individuals to enroll. They pulled out last year, and 2025 being the plan year that we went to what's called the Georgia Access Exchange. It is a state-based exchange exclusively for Georgia residents. So there's no more federal marketplace anymore for the state of Georgia. And that happened this year, 2025. So those that are under 65 and they have a marketplace plan, they know that. They know that. So one of the reasons that Georgia has their own state-based exchange is it gives the state more buy-in, if you will, on how things run in the state of Georgia.
Right.
Georgia did not expand their Medicaid. And so having their own state-based exchange kind of helps to manage that transition of Medicaid, Medicare, and how we actually service Georgia residents. It also helps to do voter registration. It
Mhm.
also helps to seamlessly manage families that children could qualify for Medicaid to go straight from the exchange over to Department of Family and Children's Services to see if we can get those children covered. And it also seamlessly helps those that qualify for Medicare to move over. So
Mhm.
that's one of the good things that has happened um, with the Georgia Access Exchange.
Okay. So now with the cuts, so I'm just pulling some data, our
Mhm.
trusty chat GPT.
Uh-huh.
It looks like about 42% of our business sector is using some type of ACA coverage.
Hmm.
Okay. In Georgia, and then 45% in South Carolina.
Hmm. Hmm.
So that's a pretty high percentage.
It really is. And the good news is, I
Uh-huh.
know to share something with you. Back when the Affordable Care Act first came out, my husband and I were very, very involved in the whole rollout with the federal marketplace. And Ronique, we saw some wonderful situations of why the Affordable Care Act was so necessary. I don't even think people understand. Sometimes we had this couple that they had a set of twins and they were born with severe heart challenges,
Mm-hmm.
and they needed the care that their insurance didn't give them. So they got a legal divorce so she could go on Medicaid so that she could get the care and the help that she needed for her children.
Mm-hmm.
Along comes the Affordable Care Act that eliminated pre-existing conditions, right? There's no pre-existing conditions under the Affordable Care Act. There's no pre-existing conditions that were ruled out under the beautiful bill either. They kept that in there so
Uh-huh.
that if you find yourself with high blood pressure or diabetes or a chronic condition, no matter what age you are, you can't be charged more for the coverage. That is paramount. That
Mm-hmm.
is huge. You won't be charged any more for your condition than a healthy person. So that's a big deal. So with the big beautiful bill, they kept that in
Okay.
so that this 45% of Georgians that's on the Affordable Care Act, they can keep their coverage
Mm-hmm.
without being penalized for being unhealthy or sick in any way, right? Some of the things that changed. Did that answer your question? Did that speak
Yeah,
to
that
it?
answered the question, but let's go ahead and get into the changes like you were about to. Yes.
Well, as best as we know, like I said, the sausage is still being made in the
Mm-hmm.
background of all of this, but we do know that um, enrollment is going to start November 1st. The reason I'm so excited about you giving me this opportunity, Ronique, is we want to get ahead of the curve. We want to be, you know, on time, which is early, right?
Mm-hmm.
So, what I would say to anybody that is currently on a Georgia Access plan via ACA or ACA via the Georgia Access Exchange is get your paperwork ready. Make sure that you can verify your income. Back in the day, you had 90 days and then an extension of 2 months to get your paperwork in, and you were covered. From what we are learning is you're only going to have 90 days to get your paperwork the way that it needs to be. Going into 2027, it's going to be 0 days. You have to have that paperwork ready immediately in order to get your plan. But this year, they're slowly moving us over to 90 days with your verification of your income, verification of household, verification of address. And it's going to take a little bit longer to get it to CMS and get it back. So when you get with your agent, and here's the other thing. It's not like going and picking a movie for Netflix.
Mm-hmm.
Get the help that you need to get this right the first time.
Right.
No one pays the agents but the carriers for which the plan actually goes through. So it doesn't cost you anything. Okay.
Mm-hmm.
Um, the other thing is if your household has changed in income and those that live in your household, the federal poverty level amount has changed as well. We'll get into the federal poverty level another time, but for those that have dealt with the exchange, they understand that.
Mm-hmm.
The federal poverty level is done at the federal level that tells CMS how much you need to make in order to get a subsidy. The subsidy was a huge thing, and most of that is going to go away on most metals: bronze, silver, gold, platinum, other than the silver. Before, and this may get a little techie, but a lot of people have very little to pay for their insurance,
Mm-hmm.
for their health insurance coverage, depending on the family size and how much people make. So now, if I'm right, if you're two people in a household, husband and wife, because your children have moved out, they are adult children over 26, they've moved out. If you make together more than $84,000 together in that
Mm-hmm.
household, you will not get any help this year. There's no subsidy for you. There's no money that's going to help offset your insurance coverage.
So back up, because let's kind of talk about, for those who may watch this later or is watching it now, we have some viewers. Talk about what's the subsidy, because people may not be like, they don't understand. Put it in layman's terms for what that means, and then it sounds like the amount you can make changed.
Yes,
If
yes,
you get out if you can get the subsidy or not for the
that's right.
insurance. Okay.
So the subsidy is like a tax credit that used to be the federal government gave, um, particularly those that came on the silver plan.
Mm-hmm.
Now, with the big beautiful bill, if it used to be that the federal government gave this tax break, this subsidy for your insurance to be lower. Let's say, for example, maybe your insurance for a household of four, hypothetically speaking, it would cost to cover them $1,600 a month.
Okay.
Depending on where you land in the federal poverty level, depends on how much money the government would give to offset that huge amount. So let's say, let me write down the number so I won't forget. Let's say it was $1,300. Okay.
Mm-hmm.
Let's say you got a subsidy. Some people will get a subsidy of $900. Your monthly premium would come down to what, $400 a month to cover a family of four. Let's say it's a family of four and you are right at 100% of the poverty level, you may get zero premium.
Mm-hmm.
That premium is offset by the subsidy and the tax credit that you would get from the federal and state government. Now, from what we are hearing and learning, that subsidy you may get less this year because they're giving less. So you're looking at your premiums being 25 to 50% more coming into the new year. It's not baked in just yet, but the beauty of this conversation is to get people thinking about what they need to bring to the table to make sure they can have their family and household covered.
So, so if you just now joining live or you're coming in midway, I'm talking to Bridget Scott uh, from Scott Insurance Agency, and we're discussing the big beautiful bill that passed this summer,
Mhm.
and the changes. And so it's a lot of changes that's happening in the bill, and it's a lot of confusion. But one of the biggest ones that's going to really impact a lot of folks, whether you're a business owner, personally, or on Medicaid, is the insurance changes
Mhm.
in Georgia, which is what we just discussed, the subsidies. So subsidies are normally estimated about $523 per year or more for a lot of the families. Those have had major changes. So be expected if you're on ACA to possibly have insurance costs come January 1st,
That's right.
2026.
Mhm.
So you may have higher insurance costs. You know, we're talking about the cost of rent. We're talking about the cost of food. We're talking about the cost of taxes, property taxes, and everything. So the cost of everything really is going to impact all the households, especially when these things take effect. And because it is going to affect so many Georgians and and those in South Carolina, we're having this conversation today. And so I think Bridget, we actually we were talking maybe about a few weeks ago,
Mhm.
and we were just discussing a lot of different things, and this conversation came up, and I said, Bridget, I have to get you on live so we can start talking about the insurance changes and make sure that those who are connected with the Great Augusta Black Chamber of Commerce are preparing and hearing this conversation, and share this out, guys, or start talking to your family and your friends about this so that everybody can start to be getting prepared. So now that we've discussed the subsidies, you were kind of discussing other changes. So I'm gonna let you
Mhm.
continue on with those changes.
Okay. With the open enrollment starting November 1st, during COVID and some other things that happened in our nation, oftentimes over the last few years, it was extended until like January 15th, or I think even the 31st and maybe the 1st of February. Well, it's gonna, they're talking about, it's not a final rule yet, November 1st to December 15th. That's what so I would say get in touch with your agent or get in touch with an agent the beginning of November.
Mm,
We don't know when they're going to do the cutoff. So you don't want to wait until the last minute to get this stuff done, right? So start November 1st. And there's a lot of agents around. My husband and I, we have a team of agents. And so this is what we do. Catch up with your insurance agent, talk to them, say, tell me what I need to get and what I need to get ready so that I can be ready for January 1 for my insurance to continue to be enforced. One of the things that they talked about, the government talked about, was re-enrolling everyone. They've changed that. For 2026, you will be able to enroll if you want to keep your plan. You can keep your plan for 2027. You will have to do your verification. If you get a zero premium,
mm-hmm,
a lot of people were fortunate enough to get the types of subsidies and tax credits by which they had a zero premium. If you don't verify your income, you're going to be charged $5 for every month that you don't verify. Now, as an agent, I would tell all of my people, the clients that give me the opportunity to earn their business, Ronique, we're
mm-hmm,
going to get your paperwork in and we're going to have it in right so that the implications when it comes tax time won't haunt you. It won't, mow you over, because if we don't help and encourage them to make sure their paperwork is right, what you're doing is putting your family and their health at risk.
mm-hmm.
This is very serious business, right? And we have to treat it as such. So the guidelines are going to be a lot more strict. Let me put this out there, Ronique. Any DACA people, your insurance is going away.
What's DACA?
DACA, the immigrants in this country that are here on
Okay.
green cards,
Okay.
those individuals, you're not going to get subsidies anymore. That's what they're talking about. You're going to have to make sure that we let people know that if you have green cards, if you're here on certain types of visas and that kind of stuff, most of that stuff is going to go away. That's what we're learning now. If that's going to be a part of the final rule, I don't know, but I know back in the day in our book of business, we had a lot of people that were here on green cards and different types of visas that were legally here that got insurance. That may be coming to a close.
Okay. Now, when is the final rule due to come out? Do you know?
It should be out by November 1. However, I've seen things change in the middle of a plan year. So we're excited and looking forward to some of the final stuff really rolling out by November 1st, because we're going to need that information to help people enroll and to get people up to speed on what they need to do. If you have a plan that you didn't pay, if you have a plan that you are past due on your premiums, it's a non-starter for 2027.
Okay, so back up. Well, you can't just. So you're saying if you can't just throw that out there, Bridget, and then just skip over. Okay. So you said if somebody's enrolled for 2026 and then they don't pay their premium, like 1 month, they can't enroll it all for 20.
If you are past due on your premiums, if you're past due 1 month, 2 months, oftentimes we found that sometimes, I think they gave you what, Bill, 90 days, 6 months, sometimes grace period, 90 days to get caught up, right? If you don't get caught up and the sun sets on you November or January 1 and you are not paid up on your premiums, you will not get insurance, period.
So what if you get caught up, then can you then enroll?
You can. Okay. Now, here's the thing though. As an agent, I would tell our clients, please, let's get caught up before January 1, because you have to have a special election period. A special election period, Ronique, means I moved, my household is different. We moved to Medicare, Medicaid, something happens to trigger a special election period, right? If you don't have a special election period and the only reason you did not get a plan is because you were past due on your premiums, then most likely you're not going to be able to get a plan that starts January 1 or even February 1, or if you can get a plan at all, until you pay that debt.
And so that is changing, not now, but in 2026. So that's be the new rules for 2027. Is that my understanding? So 2026? Or
no, that's 2026.
So that's 2026.
That's January 1, 2026.
And is the period of not having payments, is that still the same? Is that still 90 days or is that now 30 days?
Well, it's anything that's past due. So right now in 2025, I think some people go 90 days, 6 months. It just kind of depends on the carrier. And if they're saying, you know what, we're going to give them a little more grace to pay this bill and stay covered. But for 2026, if you owe a carrier, you're not going to get coverage, period.
So I guess my thoughts, because Medicaid is going to have a reduction, possible reduction of 2.29 billion in Georgia and then 2.3 billion in South Carolina. I could imagine if those who get off of Medicaid or find themselves without Medicaid may be looking at the option to come to now the marketplace, ACA or Access Georgia, whatever it's called, because it's possibility that they may lose their insurance. They could even miss filling out the paperwork, which I know is already going out, because I know several people who have received it in our region and had to fill it out and make sure they send it in. I guess my question is, do you know if there's any caps on how many people can be covered?
No, there's no cap, and let's talk about that.
Uh-huh.
Um, the beauty of trying to get ahead of this, and sometimes the hard part is being able to truly define what we think is coming, but we're not quite sure, right?
Mhm.
And so, with Georgia not expanding Medicaid and knowing that there are cuts coming, I need everyone to understand, make sure your address is right. Make sure you read this stuff when it comes regarding your Medicaid. Part of all of those numbers of people losing their Medicaid, they've already attributed at least 30% of that of people that don't read their mail,
Mhm.
people that don't recertify, um, the Department of Health and Human Services not having the right address. It
Mhm.
is incumbent upon us to have this stuff where it needs to be so that we can stay with the services that we can have for as long as we can have them. Now, I have people all the time, Ronique, say, they didn't send me anything. They mow down a lot of trees on one household, sending you mail after mail after mail after mail. But what we're going to have in collaboration with the Center of Influence, like you, Ronique, is opportunities for people that have Medicaid to come to us in a central location so we can help them fill out that paperwork. We want to take away any excuses that's going to hinder people from getting the help that they need. So Medicaid not expanding in Georgia and the cuts that's coming to Medicaid, we need everyone that can possibly qualify to do what they need to do to stay qualified.
This is this is where I get on my little rant. I'm trying not to. Cause I always think about all the money and the GDP that America has.
Mhm.
And we're still talking about sending a piece of paper to someone to fill out when you have all the tax information, all the data in your system.
Well, yes, but listen, things happen, right? And so now Georgia has, I think it's called
Did you try to
Gateway.
clean it up? Clean
Yeah,
it
I'm trying,
up.
I'm trying, I'm trying. Because look, I got to work with these folks. But listen, so Georgia has like the gateway. And so for those that aren't computer savvy, it is really simple to get with someone that can help you log on
Mhm.
and click a couple of buttons to verify who you are. Now, Social Security offices are closing. There's just a lot of things happening. And if we tried to, Ronique, we couldn't get this done in 2 or 3 hours. So we're going to have to, get this elephant in a couple of few bites and then continue to grow because it's going to get turbulent. But when it comes to, look, we need our health. We need our health. And what the Affordable Care Act has done for tens of millions across the country is people are able to go to the doctor, right?
Mhm.
Um, and so, no matter if your Medicaid is cut or your Social Security doesn't go far enough, whatever the challenge is, I know we can get through it together. There's going to be an answer, there's going to be a way. And if people know folk like you, Ronique, you're going to help find a way. There's so many people out there that's so passionate about, I'm not going to let Miss Mamie go hungry. I'm gonna make sure that child gets a meal and they get what they need to be healthy. And
Mhm.
this in you know we've seen tough times. I was looking at some pictures the other night with my mask on, and uh, we're here. We got through it, and we will get through this. I don't know as much as I will know as we get closer to the enrollment time for November 1st. But if I may,
Mhm.
I'd like to also pivot to the baby boomers.
Okay.
I am a proud baby boomer, a proud grandmother of 3 grandchildren, and baby boomers, I think, is from 46 to 64, 1964. So I'm on that 60s end of things.
Mm-hmm.
And the thing that the Georgia Access Exchange also does is when we find our seniors that were born like right at November 1st, 1916, they got to get off of ACA
Mm.
or their group coverage. They don't, if they, as long as they're working, they can stay on their group coverage. But if they're on
Mm-hmm.
ACA and they're turning 65, they got to go. I mean, there's no, I'd like to stay. You have to get another plan. You have to go on Medicare.
So they're
Right.
moving. So they're working to get all the baby boomers off of ACA
hmm And that's, and I mean, and that's
and
always
moving
been.
them to Medicare or Medicaid. Is that my
That's
understanding?
with Medicare. Medicaid
Medicare.
but Medicare is age based. So once you
Okay.
turn 65, if you're not still working and on your employer coverage, you must go on Medicare. And that'll be another time, another
Mhm.
conversation. Because some people's like, well, what if I don't want to go on Medicare? Well, first of all, you paid into the system. It's yours to do. And secondly, you have to have the health coverage. And so, what the Georgia Access Exchange does is it makes it easy for our seniors turning 65 to go on over into Medicare and get their Medicare coverage.
So, okay, so that's interesting, and that didn't exist before. So that happened because of the Big Beautiful Bill.
No, that's always been. That's
Okay.
always been. In anybody, my age is kind of sort of looking forward
Mm-hmm.
to the day that we're not paying the premiums that we pay on the ACA side. I mean, it was very, very expensive for us, and my husband is now a proud red, white, and blue Medicare card carrying kind of guy. Yeah,
Okay.
yeah, yeah, yeah. So, and I'm right behind him.
Uh-huh.
Getting letters from AARP for years now. But all of that is going to make the transition easy. The other thing, Ronique, is
Mm-hmm.
getting with an agent that knows what they're talking about. And when we don't know, we find the answer because there's no one size fits all.
Right.
Everybody is different. I have never sat down with the same situation
Mm-hmm.
twice. Everybody's a little bit different. So with the changes that's coming, one of the things that I told you that I didn't want to do was come on and be definite, definitive, and scare the bejesus out of people because that's not what we're trying to do.
Mm-hmm.
We're trying to get people prepared for whatever comes, knowing and being confident in the fact that we know and we're gonna make it through it. We're gonna make it through it. There's so many pieces to, what I wanted to do, Ronique, is no fluff, no politics, just an honest, open conversation about how do we get ready to do the necessary work that 2026 is going to usher in.
Mm-hmm.
You know, the light bill is over, it's out the roof. You
Mm-hmm.
know, electricity is expensive. I just read an article this morning about Georgians complaining about their July bill,
Mm-hmm.
right? So with all of the things that is coming with change, making sure your health care coverage is intact is a whole lot. People are being laid off, cutbacks at the state and federal level.
Mm-hmm.
All of that impacts how much we pay for health insurance and how we take care of ourselves.
That is true, very true. Now I know it's we're a little bit deep into the conversation, and the reason, and one thing that we've been doing at the chamber is we've been keeping this at the forefront, and we will continue to. Our members has asked us to. We will continue to have snippets on our Friday calls. We'll continue to talk about it, especially until those changes happen January 1st, 2026. So we'll have a lot of evergreen content out. I'm personally am putting out content on my YouTube page just to kind of help people navigate through it, because I know a lot of times everybody's busy with the day to day, and when it hits, that's when they're going to be looking for help and assistance. So then we're going to be able. That's why this conversation is so critical, because we're going to be able to refer them to this video and say, hey, reach out to the Scotts at Scotts Insurance Agents. Go to our directory. Look at those other insurance professionals. Reach out to them because they already been preparing for this. That's why we've been having these conversations for the last few months, because January will be here really quickly. I was counting the months the other day. I was like, oh, we'll be in January. Like, before you know, it's only 4 months left in the year.
And enrollment is November 1st.
Yeah, no, enrollment's November 1st. So this is going to hit a lot of people really quickly. And the other reason why this is such a critical conversation, and this is something that we are definitely talking to our members about. And I think my first letter went out about Big Beautiful Bill and the changes and impact to our business owners. I believe it was May or June when I sent it out in my president's letter to the members. And it's because healthcare is one of the number one sectors for Black-owned businesses.
Yes.
And I am talking to those that are part of the chamber. And if you're connected to us, we're still going to talk to you whether you're a member or not, about looking at who your patients are, and are they on Medicaid, Medicare, ACA, and are they prepared for the changes. Start having those conversations with your patients now, because then they're going to have to navigate their health care and their mental health as well, right? We have plenty of businesses that are part of the organization that have mental health facilities, that have retirement homes, that have home health, aid homes. That is, again, a big sector. And a lot of those patients are on Medicaid and Medicare, or part of ACA.
They have to be a part of one of those. Now,
right.
There's a lot of conversation.
That impacts our business owners.
Oh, it does. There's a lot of
conversation is so critical for everybody.
It touches every sector.
Everybody.
Yeah. Now, the rules changed, if I may say, with short-term care. Short-term care, however, you have to be underwritten for short-term care. It's an option. It's one that I don't do a lot with, but it is an option to get short-term care. They don't have to comply with the health benefits that the Affordable Care Act implemented, that you can't discriminate or deny coverage to people that are sick. Short-term care is a little bit different. However, there's some people that are healthy that look at this as an option because it's not tied to your taxes, right? So that's something else down the road, Ronique, if you would allow us opportunity, we can get into that. But this only scratches the surface and hopefully piques the awareness of the fact that there are changes coming. And we don't know all of those changes just yet, but just you being at the forefront of the conversation to let the people at the chamber and those that they love and their family members know that change is coming. And having our paperwork together, our taxes, household, the people in our household, just having your paperwork together is going to help when it comes November 1st and those platforms open, agents. Now, once again, I'm Scott Insurance Agency. Can I give out my phone number, Ronique?
Absolutely. Okay. And wait, before you do that, is there any final thoughts? And then we're going to give them your contact information to reach out to you. So if they have any questions to prepare, either as a business owner, they're looking for information for their insurance, or even to refer their patients to you so they can get enrolled properly, so their patients are enrolled in the proper insurance they need to have, so they can make sure that they can pay whatever that cost may be for that facility that they're in, or keep up their mental health coverage. And then if they have, if they personally need to reach out to you, and then also if they have family members that need to reach out to you. So this conversation, we will keep at the forefront. And here at the organization, of course, we're always advocating for a lot of things where people realize it or not. Our voice is definitely in the room to make sure that we can navigate this as best as possible. I feel like this stuff is kind of done and settled. Maybe we can get a miracle, what they call it, a Hail Mary in
Yeah,
football or
yeah,
something, where
yeah.
they won't cut the subsidies or something. I don't know. Usually once the bill passes, it's kind of done. You're just waiting on the final rule. So
That's
we'll
right.
see what happens, right? Because the bill already passed. Um, but we're going to still advocate and make sure the alternatives, because we have some unique options in our region, and we already had this insurance conversation in January, and we're going to continue to push that information out to our members and so forth, for you to get the opportunity to join in that in those type of different unique insurances, or even receiving health care at a minimum cost, which
Hmm.
we have that access in our area, which we had Welcome Health on this past January, because I don't know, I guess I had foresight that we were going to have a
Yes,
major
yes, yes.
health insurance change this year.
And we know Welcome Health well.
Yeah,
We know
so
them well.
we have some unique options in our region that other states and other cities and municipalities don't even have.
Right, right,
So
right.
that's even huge, so that people can still at least get health care, but you still need an insurance, or just in case you have an emergency and you got to go into the hospital and those things like that. So, and then the prescription costs, right? I'm not even gonna get into that right now. So get
Yeah.
this. We gotta close out. So what I'm gonna say is, so we can keep it tight, give your last final thoughts and then your contact information.
Well, I appreciate the opportunity. What I wanted to do was just continue to piggyback on what you've already started, is to talk about and have the awareness that something is afoot, have the awareness that we need to take care of our business as soon as we can. And the other thing, and the reason I didn't get too technical, because I've been doing this a long time, I know what I'm talking about. But when you start giving absolutes, that's when you get in trouble, because the only thing that's absolute is change, right? And so everybody's situation is different. When we start getting into the conversation about how much this is going to cost, is how much is this going to cost Ronique West? How much
Okay,
this is going to
you
cost
need to be
Bridget
blessed does not
Scott,
have to pay for nothing.
right? So, but I'm an optimist, Ronique. I
Yeah.
always see the glass half full. I
Mm-hmm.
always see it half full. And so I know we're going to get through this. There are professionals out there to help everyone navigate this. Um, I would appreciate if anyone has any questions, any plan reviews they'd like to have. We do it at no cost. We can be reached at 706 842 7445. Our website is scottinsuranceenagency.com. We have a team of agents that we work with. Um, we're not the only show in town. There's other wonderful agents that I have friendships, colleagues. Reach out to them. We have to go to school. We have to study this stuff. We know, what needs to happen to help you get to where you are. And, you know, know that this too shall pass. And we're going to get through it. When we hook our buggies to people that care, that it's an honest, unique situation that they can entrust us with their business.
Mm-hmm.
We're covered by all kinds of things like HIPAA and that kind of stuff. Your business is personal. Your health. I mean, look, my grandfather used to tell me, Ronique, when he hears somebody say, I had a bad day, he would say, well, miss one and see how bad it is, right? We don't have bad days. We have opportunities to make things better. So I appreciate you. Once again, my name is Bridget Singleton Scott. I'm with Scott Insurance Agency. I'm located here in the great state of Georgia, born and raised. And I work side by side with my forever husband. I had a star husband, but I'll talk about that another time. But anyway, and we love what we do. And we love the opportunity that you have extended to us. And give me a call if you need anything. If you have any questions, reach out to Bridget at scottinsuranceagency.com, or you can text me at that number. I will get back with you. And if you wanted to open it up, Ronique, if anybody has anything to
I
ask,
don't know if we have any questions before we end the live, but give me your number again, 706-842-74.
4 5.
Okay, I just want to make sure I wrote that down right. I will put
7445.
that information, of course, in the title, so you guys will be able just to reach out to Scott Insurance Agency. You can call them. Yeah, I'll have their website in there, and then I'll put Bridget's email in there too, so you can reach out any way that you may need to. But thank you so much for spending time with the Greater Augusta Black Chamber of Commerce this evening and talking about this critical topic that will continue. And like you said, we definitely going to get through it. I tell everybody that it's going to go back down to that locality, those small businesses, and us working together. And you'll see that continue to happen as changes happen in our environment. And so I know the CSRA, I know the Greater Augusta area, and we pull together when times like this happen. So we're going to be fine and we'll figure it out, but you need to prepare.
That's right. Okay. And, we have some of the best doctors, the best hospitals. Mm-hmm. We have the infrastructure to do what we need to do. We just have to make sure we're prepared. We get the word out. We help each other, and we'll get through it.
Yep, we'll get through it. Yes. So, any last words? Are you good?
I think I'm good.
Okay.
As the final rule continues to evolve and we learn more about how we can help each other, I hope that you give us the opportunity to come back and share what we've learned as we continue to get this information leading up to November 1st. That's for the under 65, the over 65. It starts October 7th for Medicare annual open enrollment. And so that's going to be a consequential year for us as well.
Yeah.
In that market for those baby boomers.
Yes. So I'm Gen X, we'll see what happens for us. We don't know. We don't know if we're going to have SSI or nothing. I'm just, we waiting to see. Okay.
Well, see, y'all gonna make it better. You're going to make it better.
We don't know what's going to happen. I don't know. We going to see. But if you want to connect with the chamber, make sure you connect with us at www.mygabc.org. Of course, our Black Business Summit is coming up. So we would love to have you in a building that's open to everyone. You don't want to miss this summit. We're going to have some critical conversations, of course, some surprises, because you know how I am. I can't do something and not have a surprise. So you want to be in that building. That's August the 28th at 6 p.m. at Augusta Technical College, one of our great partners here in the community. So we're excited to be there again for our 5th annual CSRA Black Business Summit. And this summit is going to be about preparation and preparing your business, because we are going to thrive through these changes. I'm Ronique West, your president, co-founder of the Greater Augusta Black Chamber of Commerce. It's been a pleasure talking to you this evening, and make sure you share out this information with your family, friends, and fellow business associates.